If we end up doing these on the high-low table, we'll always stand on the side of the EX. Invariably, it's going to be a little bit of that component one way or the other. But what if we only have a PI and an AS? I stand on the side of the PI probably. We use a thenar contact. Let's say we've got a PIX on the left here. Thenar, roll up and into position, and the lateral inferior board of the PSS. My other hand's going to go down. On the ischium, on the other side, push it down and out. So I'm preloading that over here. So as I make my thrust, I'm going P to A for the PI. I'm torquing cephalid for the EX, and I'm also going lateral to medial for the EX, just like that. So this will work pretty well, actually, on either a high-low table. You could do this on a chest table also. You're going to have a gap between the abdominal piece and the pelvic piece, and the abdominal piece should be unlocked so you get some extension. If I have an ASIN, more difficult to do that. I'll still stand on the side of the PIEX. I'll push that PIX way down so that in some sense elevates this ischium on this side. So when I make contact, I can thrust P to A. I'm already medial to lateral, and then downward with my torque for the AS component. Now this will work really pretty well in these geriatric patients or someone who does not have a lot of flexibility in their pelvis. It works real swell because you've already got all the slack taken out, just a little leverage and a push. Now those of you that saw that woman that had her x-rays up yesterday, 67-year-old female with that nice little sinuous lumbar spine and the osteoporosis, she had a rotated sacrum on the left with the IN, and she had the lateral, she had the hip, trochanter, and IT band pain. And I set her sacrum on the left at S2, right at the midpoint, 2 times on the high-low, and literally I stood on the opposite side when I did that, came in with my price form on her like this, just preloaded the articulation by pushing it medial to lateral, and opened the IN up, and then as I got to there, just gently loaded up that articulation and went clump like that, and it set very easily on her. With the osteoporosis, of course, I want to do it as light as I possibly can, and it worked out to do it that way. The cushions on your high-low table make a huge difference whether this works or not. And there are Gonstead specs on the cushions that you get. They're softer than your average run-of-the-mill high-low cushions. And I've had both high-lows, and the stiffer ones that does not work as well. The softer ones have the give that you need. So if you end up having some stiffer cushions on your high-low, you might want to get yourself a couple inches of foam over there at Walmart or someplace. Throw that on there when you do these. That'll give you a little extra edge to make this work for you.